My name is Moazzum Bajwa. I'm a family physician at an FQHC in Moreno Valley, California, and I'm a champion provider fellow from Riverside County. The project that I developed in collaboration with my local health department is called the Food is Medicine program. And the idea is relatively simple. How do we connect our patients from clinic who are at risk for food insecurity with the much needed nutritious food resources available within the community? As primary care physicians, we're always looking for ways to improve the health of not just the individual, but the overall communities in which we work. And during those difficult first few months of the pandemic, my colleagues and I were helping out more often in the hospital on the inpatient COVID units. But on most days, it really just felt like a drop in the bucket. And all of us were looking for some way of impacting lasting change in our community in a more significant way. And that's where the Food is Medicine program came about. By listening to my patients and hearing their stories, it was pretty clear early on that the folks in lower income communities were impacted most severely by the pandemic. And that wasn't due to the virus alone. It was from years of structural violence and generations of health inequities. So by partnering with our local health department through the Champion Provider Fellowship, we use those stories of our patients and their families to identify potential solutions for both policy and system changes. Throughout the collaborative planning process with the local health department, we met with key stakeholders, including patients, community representatives, as well as my own clinic staff of physicians and nurses. So we first started by implementing a pilot screening tool using the hunger vital signs to capture how many of our patients were actually struggling with food insecurity. And more than a third of them screened positive for food insecurity in that first month alone. Each month, Feeding America delivers a shipment of food boxes to our clinic to distribute to our patients. In addition to the food boxes, our health department set up virtual nutrition education classes so that our patients and their families could incorporate the food boxes into their healthy lifestyle. One of the lessons I often share with my colleagues is the value of connecting with their local health department. They really understand the needs of our patients and community in a different way than many clinicians. The idea that I initially pitched to the team at the health department was very different from the vision of the Food is Medicine project. But with their expertise and guidance, we arrived at a solution that was both community-based and practical, and hopefully sustainable for the future as well. Through the steady implementation of our program over the last few months, we've increased our impact from a handful of food resources and brochures to several hundred boxes of food distributed into the community.